Good afternoon. My name is Michael Hernandez, and today I will be presenting relationships between asthma and allergies for my introduction to biological diversity class. What are allergies? Allergies develop when a person's immune system overreacts to substances that are harmless. Allergies happen after a person has been exposed to the substance several times. Allergies consist of nasal congestion, itchy eyes and nose, runny nose, watery eyes, and a cough. There are four types of allergies: food allergies, medication allergies, insect bite allergies, and seasonal allergies. Who does this affect? Asthma affects more than 10% of the population in westernized countries and more than 300 million people worldwide. Asthma is very prominent in the childhood age, commonly triggered during allergy season. There are three treatments for allergies: oral antihistamines, epinephrine, and immunity injections. What is asthma? Asthma is a chronic disease involving the airways in the lungs. These airways or bronchial tubes allow air to come in and out of the lungs. Asthma inflames airways, making it difficult to breathe. Symptoms often consist of coughing, wheezing, shortness of breath, and chest tightness. For some, asthma can just be exercise induced. Who does this affect? People with history of allergies, children. Childhood asthma impacts millions of children and their families. In fact, the majority of children who develop asthma do so before the age of 5. Adults all over the world, and tobacco smokers or secondhand exposures. There are three treatments for asthma: oral steroids, medicated inhalers, and steroid inhalers. Relationships between allergies and asthma. They frequently coexist. Allergies is a risk factor for developing asthma. Allergies is presented in over 80% of patients with asthma. Allergies and asthma share key elements of epidemiology and pathophysiology. These are the four references I use today. I use the article off of Worldwide Variation in the Prevalence of Asthma Symptoms. I also used the website American Academy of Allergy, Asthma, and Immunology. I used the website CDC and Prevention, and an article off the History of Asthma Development, Understanding, and Treatments, Medical News Today. Thank you.